So asthma is a disease that affects the part of the body that is called the airway. When we breathe, the air passes through our noses, goes to the back of the throat, and then from the throat there is a tube that passes through our neck and goes into our chest, which carries the air we breathe into our lungs. So it's very, very important for us to live. If there's a problem with this airway, it causes a lot of problems for us. And that, unfortunately, is the part of the body that asthma affects. So if I can use this model to explain. The airway looks a bit like this. So when we breathe, air passes through our noses, and then it passes through this airway, and then comes into our chest. So if there is a problem with the airway, what it means is that we are going to have difficulties getting air into our chest. And that can give us a lot of problems. And in some cases, it even kills people. Anybody at all can get asthma. Little children, young people, elderly people can get asthma. And in Ghana, about 10% or more of the population have asthma. So that means so many people. We don't know exactly what causes asthma, but what we know is that if a person is going to have asthma, usually he may have some genes that makes it likely that he or she will have asthma. In addition to that, there are certain environmental conditions that makes it likely that a person may have asthma. What is interesting is that when in cleaner environments, asthma is more likely to occur. But when a person starts having asthma, then dirty environment makes it more likely that that person will have symptoms. And that's the interesting thing about asthma. There are 4 main symptoms that the person will have. Number 1 is that the person will struggle to breathe. So when he or she is breathing, it will feel as if the air that is getting into the person's lungs is not enough. And that is what we call shortness of breath. Apart from that, the person makes noise when he or she is breathing. So you hear whee, whee, whee as the person breathes. The person will also cough. The cough sometimes is worse at night. Sometimes, in fact, some people, the only symptoms they have is that they cough without the difficulty in breathing. And apart from that, asthma patients also feel tight in their chests. So they go about feeling some heaviness in their chest. And added to these 4 symptoms, they also make a lot of phlegms. Make a lot of phlegms as they breathe, as they cough. So when a person has asthma, the best thing to do is to come to the hospital for diagnosis. Another thing about asthma is that it is always there. The airway of the person who has asthma is always sick and it's always narrow. If I will demonstrate with this model, this is how the airway of a person who doesn't have asthma looks like. If you look at this, you realize that the space in it for air to pass through is quite wide. But what asthma does to the airway is that it makes the wall of the airway thick and it closes the space that the air passes through. So it makes it difficult for air to enter the person's chest. The unfortunate thing about asthma is that it is not curable, but it can be controlled. Sometimes some people promise people that they can give them some herbs that can cure asthma, but that is dangerous because it is not true. The person who has asthma always has a sick airway. So the treatment is supposed to be ongoing. That means it should be continuous. When a person has asthma, there are times that he or she will not have symptoms at all. Sometimes a person may have symptoms, but the symptoms are mild, and he can go about his daily activities with it. But there are times when the symptoms become very severe. The person cannot breathe well. And if the person doesn't come to the hospital or the person doesn't get treated, the person can even die. In Ghana, about 4 to 5 people die each day from asthma. which is very unfortunate. So it's a disease which kills a lot of people. The best thing to do is to come to hospital for an assessment. Unfortunately, some people do not come to hospital and they rather take medicines which are not effective. The popular medicine people take is called asthma drink. That is not a good treatment for asthma. When you come to the hospital, the doctor will take care of you and make sure that this is it's really asthma, and then prescribe treatment for it. So what are the treatments for asthma? As I said, it is not curable. So the best thing for asthma patients is to be on the right kind of treatment. And basically, there are two kinds of medicines we give asthma patients. One kind is called reliever medicines, and the second is controller medicines. The reliever medicines are medicines that the asthma patient takes when he or she cannot breathe. And when he or she takes that medicine, it helps it opens the airway, which is narrow, so that it becomes like this, wide like this, and the person can then breathe better. And some of the reliever medicines are, the popular one is called Ventolin or salbutamol inhaler. So when a person is not able to breathe because of the asthma, it comes as an inhaler. This is not the typical inhaler, the Ventolin inhaler, but the shape is like this. And the person pumps it into the mouth and breathes it in, and it goes straight into the airway. Unfortunately, there are also tablets that people like to use as relievers. Those are not very effective, because if you take a tablet, the tablet will now have to go into your stomach, go and dance a little bit before it gets into your blood, and then it's pumped to every part of the body, and then a little bit of it gets to the airway where the disease is. So it takes a long time. And if you are if the asthma is serious, you can die before the medicine actually starts working. But if you use the inhaler, once it is pumped, it goes straight to where the illness is. So that is the reliever medication. But the reliever medication only opens the airway so that you can breathe. It doesn't deal with the underlying problem. So a person needs a second kind of treatment, which is called the controller medicines. And the controller medicines, there are several types on the market. This is just one of them. There's a type that also looks like this. So, and they can only be prescribed in the hospital. So every asthma patient, ideally, should get a disease that controls the condition. And the thing about the controller medicines is that because the disease is always there, the airway is always diseased, it has to be taken almost every day until a doctor tells the patient that this is enough. For now, you can hold on, and then we watch to see what happens. So every asthma patient must have two medicines. One is, as I said, the reliever medicines when he or she cannot breathe. The second is the controller medicine, which controls the disease. And normally, asthma patients who have these two medicines do very well, and it prevents them from having continuous attacks. Patients who do not use, especially the controller medicines, keep having attacks on and on and on, which is very unnecessary. But once they are put on the right kind of treatment, a person can have asthma and can go a whole year or even years without having attacks. So what I'll suggest is that anybody who has asthma, whether you as a person or a family member, a friend, that person should be advised to come to the hospital for proper diagnosis and treatment. Yes, the best way to prevent asthma once a person has it is to use the controller medicines, as I said, and the person should use it daily. Another important thing about asthma is that it is very important to use the medicine well. If you don't use it well, it doesn't work well. So for all the inhalers, there are 5 steps that a person goes through to ensure that he or she is using it well. Number 1, for example, the first step is to get the device ready. If you are using this device, for example, the way to get it ready is to remove the cap. The second step is, because the medicine is gas, your chest is already full of air. So if you pump the medicine like that, the air in your chest will not allow the medicine to go. So first of all, you have to breathe out so that your chest is empty of the air. So you breathe out fully, and then without letting the air back, you put the medicine, the device into your mouth and pump it. And then you inhale it slowly into your mouth, into your lungs. And then once it's in your lungs, if you breathe out immediately, all the medicine will come out. So when you breathe in, you hold your breath and count about 10 seconds before you let out your breath. By that time, the medicine would have gotten to your airway where the disease is, and then treat you appropriately. A lot of patients, what they do is that they just take the medicine, they don't breathe out, they just pump, and then they breathe out. When you do that, the medicine will not work because it doesn't get there. So this is a simple advice for asthma patients. So in the event of an attack, what a person should do is that he should have the reliever, especially the Ventolin or salbutamol inhaler. And what the person does is he shakes the medicine, breathes out, and then pumps the medicine into the airway. Breathe in slowly, hold your breath for up to 10 seconds. If you can't, at least you should do it for 5 seconds. And then you breathe out. And then you shake it again, pump it, breathe in, hold your breath, count 10 seconds, and then breathe out. After that, you close the medicine and put it down. And then see how you respond. If after 20 minutes you are fine, that's okay. If not, you do it again. You can do it every 20 minutes until you feel okay. If after 4 times, that is about an hour, you are not okay, you have to get to a hospital. And then after every attack, you should report to your doctor so that the doctor finds out why you had the attack in the first place. And if you are doing things the right way, or if there is an underlying problem that is causing the attack, so that the doctor will treat you appropriately. So every asthma patient should know how to treat the condition himself or herself, and especially he or she should know what to do when there is an attack. Thank you very much.